Okay, hello everyone. Thank you for everybody for coming. We're so excited to host the annual virtual PASIG Program Director Panel today. Just as a reminder, the session is being recorded. We want to thank you all for your attendance. And we hope this answers some questions that you might have just about residency and matching and all of the things that you are excited to learn more about in this upcoming match cycle. So my name is Jenna Ungst. I am the president of PASIG as well as a third-year medical student at LMU DCOM Knoxville. And at this time, I would like to invite the other members of the virtual PASIG panel who helped plan this event just go ahead and introduce themselves, starting with Aaron.
Hi, everyone. My name's Aaron. I'm the Vice President of PathSig. I'm also a fourth-year medical student at UNC Chapel Hill, applying pathology for next year. I just want to say thanks to everybody for being here, especially the panelists. I know that you're all very busy, but I'm looking forward to a great event.
Hi, my name is Ting Xiao, and I'm a third-year medical student at Marian University, Indiana. And I am one of the event co-chairs with PASIG, and I will be helping moderating the event today.
And my name's Jacob. I am the other event co-chair. I'm a fourth-year medical student currently attending the University of Arizona College of Medicine in Phoenix.
And now I'd like our social media co-chairs to introduce themselves.
Hi, I'm Teo Dragovich. I'm a social media co-chair and I'm a second-year student at Midwestern CCOM.
Hello, my name is Joy Wei. I am a third-year medical student at AUA. I'm currently in New York for the remainder of the week, and I'm looking forward to hearing everybody.
Okay, great. So now we'd like to introduce our panelists. Let's go ahead and start with Dr. Evita Henderson-Jacskon.
Hello, I'm Dr. Henderson-Jacskon. I'm a pathologist at Moffitt Cancer Center. I am also the program director for the pathology residency program at University of South Florida. So I work for both hospitals. Outside of being a program director and doing pathology, I'm also the director of culture engagement enrichment for GME for the institution. I love bone and soft tissue pathology. I do some cytopathology and a little bit of breast. I love to hear your questions.
Dr. McCleskey.
Hello, I'm Brandi McCleskey. I'm the Residency Program Director at UAB in Birmingham, Alabama. I'm also the Vice Chair of Education for the Department of Pathology. In my other life, I am a forensic pathologist at the Jefferson County Coroner Medical Examiner's Office. Coming to you with a few of our other colleagues from NAME here in Denver. So excited to get to join you guys today.
Dr. Hendricksen.
Hey everyone, I'm Kammi Hendricksen. I'm the program director at the University of Chicago. So hello, and this beautiful, warm, balmy day in Chicago. My primary role is as a medical renal pathologist, but I do some GU as well. I also direct the pathology course in the medical school, so wear a bunch of hats, but the thing that excites me most is working with trainees and mentoring. So that's how I, kind of came into the program director role and course director role in the med school. So it's really exciting to see all of this excitement about the field of pathology, and I really just want to welcome everyone. And it's such an interesting, exciting community with so many warm and engaging people. And if you're going to be going through the interview process this year, I just want to say welcome, and I'm looking forward to meeting you. We all are looking forward to meeting with you and getting to know you better. And congratulations on choosing the most amazing field of medicine, and looking forward to the panel.
Now, Dr. Samedi.
Hello, I'm VanSandt. I'm the program director at University of Colorado. I'm a head and neck pathologist, and I also do cytopathology. Like all my colleagues, carry multiple hats. I'm the chief diversity, equity, inclusion for my department. I'm looking forward to meet you guys and some of you if you apply to Colorado. Hopefully, to see you virtually. So glad to be here. Looking forward to hear your question and the discussion.
And now Dr. VanSandt.
Hi, everybody. I'm Mandy VanSandt. I'm the program director and vice chair for pathology education at Oregon Health Science University in Portland, Oregon. I went to Oklahoma State University College of Osteopathic Medicine and did my residency here at OHSU, and then did Search Path and Transfusion Medicine Fellowship. So I'm one of those academics that does AP and CP, transfusion medicine, hemostasis, testing, and then GI pathology. Our program this year is going to go to our full new complement of 16, so we're recruiting for 4, and we have a new AP-NP track to offer this year also. So interested in all those things. If anyone else is interested in those, I'd be happy to answer questions. Thanks so much. Good to see you all.
And Dr. Jackson.
Hey everyone, Nicole Jackson, also chiming in from NAME in Denver. I am at the University of Washington. I am not a program director, but I am chair of our Justice, Equity, Diversity, and Inclusion Committee, and we work hand in hand with our Residency Recruitment Committee, and we have a very holistic application to our program. We do have 5 AP-CP slots, 1 AP-NP, 1 AP only, 1 CP only, and almost every fellowship you can imagine except for head and neck. So I'm excited to be here.
Great. We are also glad to have you here, and thank you again for taking your time to join us today. Jacob and I are the event co-chairs of PATSIG, and we will be moderating the Q&A today. Just to give a layout of how the event will run today, we asked for questions when you RSVP'd and chose the most commonly asked to go through today. If there is still time, we will take new questions, which you may ask via the chat. All attendees are muted except for the panelists, and the event will be recorded and we will post it in about a week or so. We'll ask a question and ask one of the panelists to answer. And if anyone else on the panel wants to add anything from their perspective or something that is specific to their program, please feel free to chime in.
All right, great. Thank you, Ting. So we'll start with our first question, which we'll have Dr. Henderson-Jacskon start to answer first. So one of the common questions that was asked was, besides research experience, what type of applicant experiences do you place the most weight on when deciding who to extend an interview offer to?
That is a good question. And it all starts when our applicant reviewers, which are separate from our interviewers, we sit together and review our mission statement and program aims and kind of look for what qualities of candidates that we're looking for. And so we're specifically looking for individuals have good communication skills, have a very strong work ethic, can be a team player, very adaptable, proactive in their learning, very receptive to feedback, and resilient and honest. And so looking at the ARIS applications, when we are looking at it, we will look at the experiences, attributes, competencies, and metrics as a whole. And within those areas, again, geographic ties take into place because my program is in the South Atlantic region. So individuals who want to be in this geographic area are definitely considered because people want to be where they are most, comfortable, where they have support and family, what the life experiences they have from that inputted in their 10 experiences, and then the most distance they have traveled. Looking for prior work experience. Those individuals have been in the workplace, have some experience in dealing with other colleagues and how to resolve conflicts and have some skills with some conflict management. Teaching and mentoring experience, again, is always a plus in the medical field because we are always in continuous lifelong learning. We have to teach each other, but we also have to teach our patients so they can understand what reports means. What do these lab tests mean? How are we helping your clinician? attributes. Those are things I gleaned off of the letters of recommendation because I'm trying to get to know this person just outside of metrics. How are they with others? Are they committed to this specialty? Do they show that intellectual curiosity? And then lastly, we look at how did you do in your courses, in your clinical care, okay? Looking at those competencies. And then all those are taken in together into how are we going to kind of look at who we're going to first have our first set of interviewers, and then we usually have a second set of candidates that we would like to interview. Research experience, yes, it's very helpful, but because my program aims and mission statement is not research heavy, I'm not looking for individuals that have R1s, have already had grants, and have over 50 publications. That is not my type of program. I look just for, yes, they had some research experiences and we can help them with something additional.
Great, thank you. Are there any other panelists that would like to contribute to that question?
If you don't mind, I'll just echo exactly what Dr. Henderson-Jacskon said. You know, when we look at the application, we really have two key things: our passion for pathology and a good work ethics. Research, while you get some point for doing it, if you publish or some abstract, it certainly it won't be the main criteria to really decide who we invite for interview, eventually for ranking. So it's really grouping all exactly. I think we followed the exact same blueprint at USF, but research not really a top priority per se.
Our next question, unless other panelists have something else to add, is for Dr. McCleskey. And many of our questions that were submitted have questions about signaling. What advice do you have for applicants in regards to program signaling and geographic signaling?
Yeah, I'm excited to answer this question. So I recently, along with a few others that are on this panel, were present at the AA PATH meeting this summer, and this was a topic of conversation in conjunction with holistic review processes, which my colleague went through very well, and I would echo everything she said. I was actually putting in the chat that it was refreshing to hear this type of approach, and these characteristics are being looked for across the board because it's the same at UAB as well. So we highlighted, or what I was interested to find out, is that a lot of programs were highlighting the value of geographic preferencing. For my own program, I do the same. Geographic preferencing for my region speaks very highly to me, particularly because of the size of my program and what I believe the caliber of our program is. So I have advised students to use that to really help speak to the program directors that are in that area. So some of us, don't have a ton of programs within our region, so that geographic preferencing really means a lot to us. And even the programs that do have a lot of residency training opportunities in their region still do put a lot of emphasis on that geographic preferencing. So I understand the pull to say that you have no preference and you would go anywhere, and that's okay if that's absolutely true, but I would try to communicate if there are places that or programs within those regions that you really would like to be at to utilize that geographic preferencing area. In terms of program signals, I will be transparent with you. I tell anybody that does an observership or a rotation in my institution, do not signal me. If I have invited you and allowed you to come roam our hallways, then I think it is important that you also get to interview with us and continue that journey. So I do not have anyone that's rotated with me signal me. I think those signals are precious, and they really should be reserved for those programs that it's like knocking on their front door. You really want them to look at your application and you really want to say, I would love to train there. The signals are not shared beyond application review. So we do a holistic review process as well, and that geographic preferencing as well as program signals are used primarily by the program leadership doing the review process, and they are not shared with interviewers or the selection committee. I think that's an important piece. That's the recommendation, to not utilize signals as part of ranking, and we align with that. So any of you who are doing experiences at other institutions or even your home institution, be sure to reach out and ask if they want you to signal them. There are other specialties that do want you to signal your home program. So you may get mixed messages from your medical school administration and other colleagues that are going into other specialties. So since we only have 5 signals, I will tell you there's conversation about how many signals to use in the future, but this year it has stayed the same. Use them judiciously and make sure that you find out if there are certain programs that you have experience with that want you to signal them. If you come to UAB as a visitor or a rotating student, then I tell you not to signal me, but geographic preferencing is still very important.
And we do have a question coming through the chat regarding geographic signaling specifically for non-US IMGs.
Yes.
Could one of the panelists, or could Dr. McCleskey, you to elaborate on that?
So I still think, and you can correct me if I'm wrong, but I'm certain that you get 3 opportunities to put geographic preferencing in. I would try to highlight, identify the programs that you are very interested in and the regions that they may be located in, and try to indicate some geographic preferencing. Do not leave it blank. Just if you have no preference because you don't care where you go in the country, then you can say that, and I think that's appropriate to say. But if you do, it is an opportunity for you to at least show the programs that are in certain regions that you are interested specifically in them.
Great. Is there any other panelists that would like to contribute to the signaling question?
I'd like to make one comment that maybe some of the other program directors can relate to with geographic preferences versus the signal for a program like mine, where if your geographic preference is the West, it's a pretty big area. And sometimes I interpret that as I'm interested in California, right? Because so many programs are in California, and we just have like one in Oregon, and there's one in Washington, there's none in Idaho, there's none in Montana, there's none in Alaska, etc. So the signal is a little richer for a program like ours because it means you're actually interested in OHSU rather than maybe applying to all the schools in California. So keep that in mind, I guess, when you're thinking about the difference between signaling and geographic preference for smaller programs or programs with less dense numbers around.
Great, thank you. Our next question will start with Dr. Hendricksen answering. So many pathology programs do not report having a step 2 or COMLEX score cutoff. But that being said, there's a number of applicants that submitted a question talking about how does a low passing score affect an application? And then if someone has had a previous failure on one of their board exams, how does that affect their application?
Yeah, happy to respond, and interested to hear what other programs think about this question as well. I certainly want to echo everything that Dr. McCleskey and Dr. Henderson-Jacskon said, that, our application review process is really, we take a very holistic approach. And me personally, I feel like the test scores, and as we've transitioned from actual scores to pass fail, and we'll see what happens in the future, I feel like test scores are really, I wouldn't worry too much about them, is the main point I want to get across. When we are reviewing applications, when we're going through the interview process, we're really focused on, you as a person. Why are you interested in pathology? How did you get interested? Demonstration of experience in pathology. Do you know what you're getting into? Because, it's a hard field to really get a good grasp of. And if you can demonstrate that you have had experiences in pathology and have a good, a reason for going into pathology and choosing pathology, that's very important. But also, as the others have said, like, we want well-rounded people. We want team players. We want, people that are, excited and resilient. And, it's that is very much what we're focused on when we're looking at applications. So a low passing score to me makes, like, really does not make any difference at all. The score doesn't make a difference. A previous failure on an exam, I mean, as long as you've achieved a passing score, I don't think a previous failure is a major red flag. Like, we all have different things going on in our lives, and have, we've had, experiences and where people have taken exams when something challenging is going on and they've failed. And it doesn't mean that they're, inadequate in any way. It's something else was going on in life, or they, hadn't prepared properly. And so to me, that's not a red flag. So in general, just my whole perspective on exam scores, we're all getting to the same destination. We all have different routes that we take. And to me, the score on an exam really, it does not sway me in any direction. And there we have Dr. McCleskey saying that a single failure on a exam is not a red flag. So that's my initial response to that question. I'm curious to hear if anyone else has any thoughts on that.
If I may. So we exactly. So your score on the step 1, 2, and it's not the only criteria we look. That said, when we assign points to your application, if you pass on the first attempt, regardless of the score, you get the highest point for that category. And if you have one failure, that's also not so negative. But if you have multiple failure, that's when we start to look a bit more. Is there a pattern from your medical school and other things that support that? So the most negative is having multiple failure. So one failure does not, necessarily negate you from having an interview for us, but multiple failure probably will.
Great, thank you. We'll move on to the next question for Dr. Samedi. Some applicants have expressed concern over letter writers not submitting a letter of recommendation before programs begin reviewing applications. So does submitting a letter of recommendation after September 25th negatively affect an application? And are those letters still reviewed?
Thank you for the question. Short answer, no, it does not negatively impact your application, because we do understand it's not the applicant's fault. We're all busy. Sometimes the faculty you ask rather question may not be maybe busy or occupied by something else. That said, we would prefer you get it before November 1st. I'm sure every program has different deadline, because we want to review. We will review your application as soon as we get them. And if there is a missing letter of recommendation, we put a note to come back to it, especially if we're interested in your application, but it does not negatively impact. But I would strongly advise for you to reach out to the people you ask politely, of course, like a gentle reminder to make sure they get the letters in so we can review them. Especially this year, I think about 75% of pathology program will not send an offer for interview until October 18, I believe. I don't have a calendar for me, but I think it's October 18. So you won't get anything. So we have some time if your letter gets, for us, we said November 1st. But make sure you reach out to the people you asked to, give them a gentle reminders if they have not done so.
Great, thank you. Is there anyone else that would like to speak to that question?
I would like to just make sure all candidates know to research the programs, look onto their program websites, and look at any information that they may say, because there may be programs like myself, where I am looking at applications when they're first coming through. I get over 500, 600 applications. And so my applicant reviewers have to start looking through these things. If you do not have all components, which we require at least 3 LORs, you're not totally just removed and being looked at. You place like, okay, this is whole, that is not a fully complete application. And so we will go back later to look at that application. Okay. The thing is, when I'm already set and I'm putting out interviews by our date of October 18th, me going back after probably October 18th to re-look at additional applications to add is probably very highly unlikely. I get my interview invitations out. I set up my interviews between October through December. I usually do not extend out into a January. I'm only filling 3 positions, so it's different for different programs depending on the number of positions that they are having to fill, about how many applications they're going to review and give interviews positions. So please look at and see if these programs do that second look. Are they going back? So you can see that information.
And then it looks like Dr. McCleskey was also helping answer in the chat questions about number of letters being sent. Okay, yeah, that makes sense. Did you want to say anything else, Dr. McCleskey, beyond what you said in the chat?
Yeah. Oh, I just think I'm gonna just watch the chat in the interest of time, because I think
Sounds
you've got some
good.
good questions on here. So if I feel like I need to pipe in, I'll pipe in. But otherwise,
Sounds good.
I'll keep an eye over here.
Okay. All right. So our next question, we'll have Dr. VanSandt answer first. So the AMC allows the use of ChatGPT or other AI tools for brainstorming, proofreading, or editing, but in states that they require applicants to only submit their own work on their application. Do you have any thoughts on applicants using AI tools while preparing their application?
Yeah, thank you. I thought this was a really great question, and there was a piece of me that thought maybe there was some higher power at work, because I feel like I've dodged this question multiple times, not really knowing what our collective, answer is on this. So I'll give you, I think where I'm landing currently is that I think it's okay within reason. Your personal statement needs to be honest and interesting and about you, like containing details that a bot or something wouldn't know, and really reflect what you want your journey to be. Like, where do you want to end up in pathology? How did you find it? Why are you interested? And kind of talking about your arc in the discipline. And I don't think the bots can help with that. On the other side, I have talked with some of my own residents who say they feel like some of these tools level the playing field. Like one person said they had someone who's applying at the same time who's a family member or something, was like an English professor and could help edit and read this for them, and other applicants don't have that. So I think it could be useful for fine tuning or refining what you want to say in your application. So I guess when I'm saying yes within reason, I feel like it really does need to be your work, and it needs to be about details about you and where you want to go in your profession, but that some of the aspects or fine tuning can be helped using those tools. And I'd love to hear what other people have to say.
I'll just chime in. I did put it in the chat, but I like the point that you made about sort of grammar review. So I think that is a nice opportunity, to input something and say, because you can ask these bots lots of things. And if you really feel like, particularly if English isn't your primary language, that's an appropriate place to utilize these types of AI tools, just to make sure your message is coming across the way that you really want it to. And even if English is your primary language, it's still a useful tool, either to get started or to help polish. But as I put in the chat, be very careful, because if you imagine 600 people are getting their personal statements from ChatGPT, the system learns as it's being utilized. And so you really don't want the same personal statement coming in each of your applications. I'll give you a historical side note. There were at some point in time, particularly during COVID, when experiences were difficult to get, there were letters of recommendation that were coming through in applications that were very similar. And it just doesn't send across the right message. Applicants shouldn't be penalized for that piece, but it's very similar if your personal statements are coming through. And I've read the same, 4 lines or 4 paragraph structure in multiple applications. That's not going to send across the best message.
Thank you. And the next question we have for Dr. Jackson. We had several questions regarding how to stand out during interviews. In particular, how can you make a good impression during an interview if you are more introverted?
Sure, that's a good question. So I think, rewinding a bit, when we look at our training, our clinical rotations, we're very much conditioned to fit in, right? We have templates for presenting patients, writing notes, what is professionalism. So we're really conditioned to fit in and not, stand out from the crowd. So I think when it gets time for application season, unless you engage in creative writing, it feels a little awkward, right? But there's only one you, so no one can replicate you. So the way to stand out is, sit with yourself and, who are you? What's your story? And I think the personal statement is the best way to convey that, especially people get stage fright. Same thing in interviews, no matter how conversational it is, right? Someone can freeze. But I personally like the personal statement the most. You have months to work on it, to perfect it and really convey, what drew you to pathology. What are your significant life experiences that influenced your whole life trajectory, including your career trajectory? But I think focusing on that is a great starting point.
May I add one more thing? So in addition to holistic review processes, some programs and others on the call may add if this is true of their programs, utilize some version of standardized interview processes. So I don't think it's any secret. I'm sure it's out there that I have something that people call affectionately the dark room. We're probably going to continue with that, and I'll have an open house in a few weeks. I'm very transparent about it. Tell every applicant about it. But it is a standardized station where there is no visual feedback from your interviewer. It does put some people. It's a little uneasy, although I try to tell you not to be uneasy about it. But it's the same questions for every single person, and it gives individuals that may not be able to highlight their best selves in a traditional interview, which does require skills that maybe not everyone has if they're particularly introverted or just, quiet but they have so much to add to the field of pathology and to medicine as a whole. And I don't want to overlook those individuals. So this station has really proved beneficial for us as something that just gives you an opportunity to talk about many other things. The questions are not pathology in nature. They're to try to pull out other attributes of your personality and what you bring to the table. I put in the chat, and I'm sure most of us would agree based on what I've heard today, that we all have the tools to teach you how to be a pathologist. We're really looking for the right people to add to our secret mix of residency, residency trainees and pathology in general. And I know that there are other programs that use these standardized practices similar to MMIs that are used for admissions to medical school. And so I just wanted to add that in terms of, Zoom-based interview practices can be a little bit challenging for some.
May I add one more thing? And at some point, I may have to reach Dr. McCleskey, but it's dark room. Sounds very interesting.
I'm trying to publish on it eventually. But
Okay, all right. So I'll wait until this published. I guess the other way to stand out is when you were doing this virtual, I think most program will do virtual, have question. the last thing you want to do is just stand there and get it's a one way. You maybe because you're introvert, I am an introvert, so I understand. That being said, many interviewers interpret that as a low interest. You were just, looking at just applying just to see what the program. So research on the program, ask question. I don't care what program you're going to interview, you're going to have two questions, one way or the other. Why pathology and why us? So that's going to come in one way or the other. So be ready for that, but also ask questions.
I just wanted to add on to this great statement about having questions ready. And I even think it's fine to ask each interviewer the same questions. So I don't think you should ever run out of questions, because you may get slightly different answers or different perspectives from those pathologists who are seeing the department differently or interacting with trainees differently. So you don't have to be like, oh, well, I already asked all my questions, I'm out. Just, see if you learned something new by asking the same question. That's okay too. And you don't have to admit you're doing it.
We do have one more question for our general question section that came up for all panelists to answer. Do you prefer DO students to take STEP in addition to COMLEX?
I would say no. We look at the complex or the step one. You don't have to take both. That's a short answer.
Yes, don't take both. It's too expensive. Just take one.
I agree.
All right, sounds good. So we're going to start asking a few questions that were IMG specific. And Dr. Henderson-Jacskon, is your computer going to let you be on for a couple more minutes?
They got me down for 5 more minutes.
All right. Okay. IMG applicants have noticed some programs only admit IMGs that have completed a medical residency in their home country. How is it important for your program that an IMG applicant has completed a home country residency program before applying?
You do not need to complete a home residency program in your country. You just need to have completed what is required in the U.S. in order to be admitted into an ACGME program that you have done medical school, how that may look in your country, and got the ECFMG certification. Then I'm allowed through my institution to be able to look at those applications, okay? As long as you're certified. Some people said, oh, my certification is coming later. That is okay. We will put them on hold to go back to those who may have certifications coming in a week or two later. We have seen those. One thing I'm not sure IMGs may know all about in the US is that different states have different state regulations and rules, okay? Especially when there was a lot of our diversity, equity, and inclusion laws that were coming across many different states. So in my state of Florida, I will let you know, you will get asked questions that will come through the email that is sent to you if you accepted interview in my residency program. That's going to ask you, are you a government official at one of the following countries? And that includes China, Russia, Iran, Korea, North Korea, Republic of Cuba, Venezuela, and the Syrian Arabic Republic. If you choose yes to that question, you will have follow-up questions about your membership to political parties. Are you physically in one of these countries currently? And they will ask a lot of other questions, okay? There is additional screening required by the state of Florida, okay? That has nothing to do with federal level. This is state level. And because I am at an institution that receives state funding, they have to go through this process. And if they do not feel that that security is cleared, even if you have matched my program, I may not be able to accept that candidate. I don't like it. I I didn't come up with the policies. I didn't vote for these things in our state, but those are one of the things that I have to do. And we make sure to email our applicants who accept interviews this information so they understand this process. It's, again, it's different by state. By state, you may want to look into those things when you're applying and looking at the program websites.
Thank you so much. Our next question is for Dr. McCleskey. INGs often have difficulty finding U.S. medical experience and are sometimes concerned that what they have done may not be considered as U.S. medical experience. So specifically, does your program consider working as a grossing technologist as U.S. medical experience? And more generally, what types of experiences do your programs consider as U.S. medical experience? And do IMG applicants need to have all of these experiences before applying?
So there's a lot to unpack here. Experiences in the U.S. are very important, particularly for those of us that are in state-funded institutions that are hoping to train individuals that will go on, hopefully, to provide medical care to the patients within our state. I understand how very difficult it is to get these experiences. Just recently, we are running into obstacles in my own institution, and I know how valuable these observerships can be for IMGs particularly. So having employment, I think we've already heard how beneficial that is. Having employment as someone who is getting skills that are applicable to pathology residency, also very important. I myself have a first year that worked as a grossing tech, pseudo sort of pathology assistant role. There's a year of graduation question in the chat I hadn't gotten to yet, but had graduated medical school in her home country quite a few years ago. So it can help at least to give us, some experiences to help understand what you've been doing in the interim. I think that's the most important piece from that year of graduation question, is I really need to understand what your journey has been since medical school. So if that includes observerships at different institutions, then I want to hear about that. And those are great experiences for you to have, so that you can understand what residency is like in the U.S. I think that's a very important piece when looking for medical experiences. So, it's a double-edged sword. Yes, I think having employment in the U.S. and being able to show that you can gain skills as a grossing technologist is important, but also having some experiences that help you understand what it's like to be a resident in the U.S. is also important, and can help you, at least demonstrate who you are and what you would bring to a program. A lot of people want to ask, what are you looking for? What about the program? What about the program? And my question usually is, well, what are you willing to give back? This is a two-way street. So like I said, I can train you to be a pathologist, but you have to actually receive that training and show up and seize the opportunity. So I think those are important things for you to be able to demonstrate within the U.S., particularly for state-funded institutions, as Ms. as Dr. Henderson-Jacskon just mentioned. Some of us have had to sort of dodge some interesting political climates, and our institutions, are really standing by our missions and trying to be creative in how we can still meet those missions within some challenging political climates. But I think it is important to have experiences before you apply, because I think it helps you speak to some of the things that we've described up till now.
Great, thank you. Would anyone like to add anything else there right now? All right, so we'll move to our next question. So we'll have Dr. Hendricksen start answering this one. So for IMGs, what are your expectations for their letters of recommendation? So for example, is it acceptable for an IMG applicant to have 2 letters from their home country and only 1 from the US with someone they worked maybe virtually with or did research with? So what would be your thoughts on IMG's letter of recommendations?
Yeah, that's a great question. And I guess what I would sort of emphasize is I think the most important thing, and probably what would be most important to all of us is, when we're reviewing applications, is to have letters from people that really know you well and can write a very strong letter. And so if it's from your home country, that's great. Like, those letters are just as valid as US letters. I would sort of piggyback on what Dr. McCleskey says, that it's important to have some sort of US experience and some at least 1 letter from, whether it was an observership, shadowing, research experience, just something to demonstrate your familiarity with the system, that you kind of know what you're getting into. Like, it's important to have some experience in the US, and it can be any range of things. As we have multiple residents in our program who were histotechs or grossing techs in the US, and that's a very valuable experience. And those are some of our best residents. So any experience in pathology is very valid and very valuable. Like, but it can be really a range of things. A postdoc in a basic science pathology lab, or whatever your experience is, it is important to have some experience in the US system. So 1 letter from one of those experiences I think is certainly enough. And if you can get strong letters from mentors that you worked with in your home country, those are fantastic, and that's really helpful for us. But yeah, when you're looking for letters of recommendation, definitely I think the ones that matter the most are the people that know you best.
Any other panelists want to chime in on this question? If not, we'll move on to the last question we have that were pre-submitted for Dr. Samedi. Can IMGs complete residency on an H4 EAD, or is it considered a less favorable visa status? And how does your program handle visas for IMGs?
Thank you for the question. I have to admit, I had to search what's the H4 that type of visa is. And I suspect the answer will be different for each program. So if you're interested in the program you're applying, it behooves you to reach out to them and see what's posted on the website and all the information. For us, it's J1. I guess I would say 99% are J1. The 1% is the O1 visa, which I didn't know much about, but it's for someone who's exceptional. A few years ago, we had someone from Nigeria who had experience in pathology, had published. It was someone, it was easy to write, to apply for an O1. But for us, J1, no H1B, so J1 only. But my answer will be to those people asking the question, reach out to this program and see exactly what kind of visa they would accept.
As an IMG myself, or I'm an international student that's going to a DO school in the US, I did some research on which programs that do give out the H1B versus the J1. And out of the programs here, we have the panelists, I believe University of Chicago, OHSU, and University of Washington are the ones that I know that give out H1Bs. But I don't know if that is changing. I know programs change all the time. If those programs can speak to that.
Yeah, we support the H1Bs, and I don't think that's going to change anytime in the future. or near future.
Yeah, same at OHSU. I mean, we're kind of thankful that our institution will sponsor the H-1B visas. I think we get a lot of great applicants through that opportunity that other programs wouldn't get because their institution doesn't support that visa. So we don't see it changing anytime soon.
Yeah, and at UW, we do support J1 visas, and then H1Bs are a case-by-case basis, and I don't see that changing, either one.
I'll just add, at UAB, we prioritize for a J1. We have done H1Bs. It's much more rare, and although we have a great international medical office that is well versed in all of these. So if you have some particularly unique scenario, then I would say you can reach out to the coordinator and we can get clarification around that. But we are primarily J1s. I just wanted to add, I put it in the chat, but you know, the program directors perhaps on the call can also give me a thumbs up on this or not, but we get a lot of emails every single day. I've counted it before, at least 10 per day during recruitment season, if not more. So it is okay for you to send an email. The coordinators may be a little more apt to reply, but I don't want you to think that we're ignoring you if we don't reply. Some program directors will put a out of office sort of reply that just says it's recruitment season. You know, if it's about recruitment, we'll get back to you eventually. But I know that there's some pressure to reach out directly to programs. You know, I'm not going to tell you not to do that. Some of the other program directors may have different feelings, but I just don't want you to think negatively that you're not getting a response or it's falling on deaf ears. I will say, please don't send me another email that says, "Hey, I just wanted to see if you got my email." I promise you the www is working, but I just don't want you to think that just because we're not replying that we're not. It's not being acknowledged. We're not seeing it. We're not choosing to ignore you, but it is a very, very busy season.
And if we got one more thing, I agree completely. I don't think we have the bandwidth during this time of the year to answer to all the email. But one email I typically do not respond is someone send me applications. Say, could you review my application and give me some feedback? Definitely don't have the bandwidth to do that. So you submit your application, it will be reviewed like any other application. So there won't be a pre-review. And I know other program directors feel differently, but certainly I don't have the bandwidth or any of our APDs to review application and then to give you feedback before you submit it. It's not going to happen.
Great, thank you. So the program directors have been doing a very good job of answering some of the questions as they've come up in the chat. So rather than give specific chat questions time right now, we wanted to give some time for program directors and as well as Dr. Jackson to share any other thoughts that they've had during the session that they have not been able to share, or maybe something you would want applicants to know that hasn't been asked. We just want to take a few minutes for that and just open it up to you guys.
I'll start. It's in the chat, but I think this is worth stating again. Programs are held to certain requirements when it comes to our rank lists and who we're going to match. In my own institution, and you know, I think this would probably be important for you to know about other institutions, there are requirements in terms of licensure. So although you may be looking at program websites, you need to go to the GME of that program and look at their policy and procedures manual. Make sure that you would qualify for certain requirements. I put in there about step 3. So although step 3 is not required, I tell every student as soon as you qualify for step 3, I recommend taking it because there's not much about pathology residency that helps or is applicable to step 3. And so it just gets one of those hurdles out of the way and you can go on and focus on pathology. My first year residents have to have it completed anyway. And so it just makes it a a lot easier. Now, if you're a DO student, you do have to have a program director attestation statement in order to qualify. So that's understandable that you couldn't do that ahead of residency. But also in terms of licensure requirements, there are certain states that have years in which you have to have completed all of your steps. And so I think it's important for those of you that may have atypical applications or some non-traditional pathways that you make sure that you qualify for licensure in that state, because it will be important. In my institution, you have to be a fully licensed physician in your as soon as you've finished 1 year of training if you're a U.S. student and 2 years of training if you're an international medical graduate. So just make sure that you know what the requirements are to be able to practice in the state as well as in the institution.
Thank you. And we had a question that came up through our social media channels just now. And it is, what is your perspective on applicants participating in couples match? Are they more likely to be ranked lower? And this is for any of the panelists.
I would say it doesn't impact. We view everybody independently. That said, if we are interested in a given applicant and I see you in a couples match, I will reach out to the other specialty program director, and they do that to me as well, and let them know they are under no obligation to pick up to offer an interview, but we'll let them know that we're interested in this applicant, and then want to know what their plan might be if they want to share. They don't have to answer me, but short answer, it does not negatively impact. We look at everybody. And then if we see that, then I'll go the extra step if we're interested in an applicant to reach out to the other program.
I would agree. It's definitely not a negative. It does present some challenges, and I think it's important to recognize that, not just from the applicant point of view, because I know there are so many challenges from you guys' point of view, but also a challenge for us. I'm in an institution with a lot of competitive programs, and so it has presented some challenges for us in terms of being able to match residents that we really want, that are couples matching. I have been successful, but it is another small hurdle, but not unsurmountable. And I would say this is one of those times where, I know I just said don't send me emails, but there have been some couples match that little piece that has slipped through the cracks sometimes. And so if I've interviewed an applicant and their partner hasn't received an interview, then I have that has at least indicated to me, hey, my partner hasn't gotten an interview at UAB. Could you reach out to that program director? And so if that is a scenario, then I think it's appropriate for you to just ping us about that, because it matters to us too. If I've chosen to interview you or offer you an invite, then I'm interested in you and your partner being successful. And so that has turned out to be helpful in the past, to just have a little reminder that says, hey, my partner hasn't heard from their program at your institution. I'm very interested in you. Do you mind just reaching out? And we are more than happy to reach out to the program directors on your behalf.
Great, thank you. One of the questions that's in the chat that I think is a good one that I don't see an answer for at this time. Maybe Dr. Hendricksen, maybe you could start answering this one. It is, what advice do you have for applicants who are entering into residency with a specific subspecialty in mind? Should they volunteer this information? For example, applicants who are already interested in forensic pathology, could offering that information put them at a disadvantage?
That's a great question. And I can speak to this as a person who, when I was applying for pathology residency, I knew I wanted to do a renal pathology fellowship. I really just fell in love with renal pathology during med school and did a bunch of research in the field and knew I wanted to do that. So when I was interviewing for residency, I went into the interviews kind of with an intention of going to the place that I wanted to complete my fellowship, to maintain that continuity. And so I think if you do have a pretty, if you have a pretty set idea, that it's helpful to, because, as a lot of institutions of course, are going to, or, you know, our training programs, when people apply for fellowships, you kind of favor your own internal people, and you want to give them fellowships and enable their success. And so when you have people applying for fellowships, you tend to, you know, the fellowships are going to go first to your own in-house people rather than outside applicants. And so if you do have a pretty good idea of what sort of fellowship you want to do, and I know Jacob just mentioned forensics specifically, then I would probably kind of focus my interviews and my attention on, you know, programs where you're going to get those experiences, or places that have, you know, strong medical examiners nearby. So yeah, if you're going into residency with a pretty good idea of what you want to do afterwards, I think it's perfectly valid to voice that during the interview process. And you know, also with the caveat that, you know, when we go into pathology, I always say, like, you know, people change their minds, because we go into pathology and no one has a really great idea of what pathology is when they're going into residency. Like, you've done rotations in all the other fields of medicine, or many fields of medicine, but no one has a really strong grasp of pathology. So we try to maintain a lot of flexibility with our pathology residents when they change tracks or change ideas of what they want to do, because, you know, as you go through pathology, every rotation is a completely new experience and you're learning as you go. So, you know, you can go into pathology thinking, oh, I want to do forensics, but also, you know, keep in mind and stay flexible, you know, absorb everything that you're going through, and be open to the possibility of potentially changing your mind. But yeah, I see no negative to expressing your interests in a particular area. If anything, I would think of that as kind of a positive, that you know so much about the field and your interests in yourself that you're kind of focused on this one thing. But I would also kind of express kind of openness to the other experiences in pathology as well.
Yeah, I'd agree. I see it all the time in personal statements, that people come in with an idea, especially forensics, but I would say I've heard stories where at certain institutions, you know, they don't favor forensics. They look down, to be quite blunt. But I think that goes back to, you know, do your research. Look, where is this an institution that's pumping out forensic pathologists, or have they never had a forensic pathologist, you know, ever practice? That might be a soft sign that perhaps if you want to train at that institution, you don't highlight that in that application, and that's fine too, right? But I love to see people who've had past experiences, and this is what drew them to pathology, and I think that's beautiful. That's part of your story, but I do be mindful.
Yeah, just to piggyback on that as a forensic specifically, but I think, you know, medical renal would be another example, or something that we don't have a fellowship in. You know, the interviews are two ways. I'd love the opportunity to tell you why it could be a good fit for you, even if you're interested in something we don't have a fellowship in. Like, who have we recently graduated who's gone into those disciplines? What faculty do we have, and what are their interests? So, you know, I'd like that opportunity as well. So be honest, tell us what you're interested in so we can have a conversation about it.
Great, thank you, everyone. There's always going to be more questions, and this session could, I bet it could be for 6 hours, and people would still have questions. But we're very grateful for the questions that have been submitted, as well as for all of the pathologists that have come and joined the panel today. We want to remind everyone that the session was recorded and will be available on our website within the next few days. We'll send an email to everyone who RSVP'd to get feedback on this session, so we would appreciate your feedback. We also wanted to remind everyone that some of the events that we have coming up in the next few weeks include a networking 101 session held by our group on Sunday, October 13th. And we have that live for registration on our website, virtualpathsig.org. And then we also do have a Google Doc that has an updated list of residency program open houses, such as their event dates, registration links, and appropriate contacts that people have been using. And you can find that link on our link tree, as well as our social media accounts. And if you don't already, you can follow us on Instagram, X, Twitter, TikTok, or LinkedIn at path_sig. And you'd get updates on those following events. So thank you again for everyone coming to attend. We're very grateful that you came, and we wish everyone success in their applications this year or in following years.